Good afternoon and welcome to the City Club of Portland's Friday Forum. City Club is where we bring civic-minded people together to make Portland and Oregon a better place to live, work, and play. My name is Susan Hammer. I'm a former president of City Club, and I'd like to welcome members and guests alike, those of you who join us today at Portland State University, and those who are listening on OPB radio or watching on Portland Community Media. The generous support of City Club's corporate and media partners ensures that we put on the state's best civic programs week after week. I'd like to thank our media partner, Oregon Business Magazine. Our current Friday Forum sponsors are AARP, Baron Liebman, Iberdrola Renewables, Perkins Coie, Portland General Electric, and Providence Health and Services. I also want to recognize the funders who made the Dental Health Task Force possible: Northwest Health Foundation, Kaiser Permanente, and Daniel Deutsch. We are grateful for your support and commitment to City Club's mission. Please join me in thanking them with a warm round of applause. At next week's Friday Forum, we will hear from 3 of the Portland Development Commission's latest startup PDX Challenge winners about the companies they are building to strengthen our community. On Thursday, December 11, New Leaders Collective will host a Why Behind the Weird event to explore new technologies, startups, and a sharing economy. You can learn more about City Club events, purchase tickets, and become a member on our website, pdxcityclub.org. Because we all love Portland, we need to make it better and better for all Portlanders. Here at City Club, membership, event attendance, the number of research projects accomplished, the visibility and impact of City Club is increasing. We are becoming a younger, more racially diverse organization focused on serving all of Portland. We are doing a good job, but there's so much more we could do. Today, we're asking you for your support, a generous contribution, so that we can build a club for every Portlander. You will find donation envelopes on your seats. Please return them to the City Club staff at the end of today's program. As always, we will be live tweeting today's program. You can follow along and join the conversation using the hashtag PDXCityClub. Donalda Dodson will facilitate a question and answer session with the audience and our speakers at the end of today's programs. City Club members, please come to the microphone and ask your questions. For all of our audience members, please locate the index cards at the center of your tables and write your questions on them during the forum. Hold your cards high, and City Club staff will collect them prior to the start of the Q&A. In the spring of 2013, health advocates proposed adding fluoride to Portland's public water supply to improve dental health. It became one of the most contentious civic debates in recent memory. Ultimately, voters rejected water fluoridation, and Portland voters appear unlikely to approve it in the foreseeable future. At the same time, too many Multnomah County's children lack access to basic preventive health care, dental health care. To address this need, the Children's Dental Health Task Force came together out of a singular desire to improve the health of Portland's children. Members on both sides of the water fluoridation debate share that goal and began meeting in the fall of 2013 to find attainable, cost-effective solutions. The task force 6 members, Kelly Barnes, Serena Boston Ashby, David Crandall, Matt Morton, Mel Rader, and Laurel Robbins, 3 who had supported fluoridation and 3 who had opposed it, unanimously endorsed 11 recommendations in a report published this week through City Club's Civic Labs. Civic Labs uses City Club's research rigor to find solutions that will lead to lasting civic improvements, but they do not affect an official position of City Club. For this project, City Club provided a facilitator, writer, research and advocacy advisors to support the work of Children's Dental Health Task Force. The task force wishes to express its appreciation to the following City Club members for their active help and support: Carol Ford, Christian Trayball, Byron Palmer, Nicole Pexton, Brett Hamilton, and Greg Wallinger. Please give all these hardworking members and volunteers a round of applause. Today, Donalda Dodson will moderate and discuss the process and the recommendations of the dental report with Kelly Barnes and Mel Rader, who are on opposite sides of the water fluoridation debate. Donalda is Executive Director of the Oregon Child Development Commission and has been involved in promoting dental health for many years. Kelly Barnes is a community member and volunteer who's interested in finding innovative approaches to improving oral health. Mel Rader is Executive Director of Upstream Public Health, an organization that seeks to find the most innovative, broad-based public health solutions that are backed by science and research. Please join me in welcoming Donalda, Mel, and Kelly to the stage.
Thank you, Susan. As was noted about a year and a half ago, out of adversaries, I said out of adversarial action was birthed a new coming together. So Mel and Kelly, would you talk a little bit about how you were able to come together to come out with this report, having come together kind of as adversaries to begin with?
Sure. Well, thank you all for being here. It's very nice to participate on this task force and to have our recommendations out in the broader community at large. Quite honestly, it was very easy to come together in the aftermath of the campaign, at least for myself, and I think for all the members of the task force. We actually share a lot of common values around public health policy, and we all desire to improve oral health in our community. We each were able to recognize that there are gaps in the current system delivering care, particularly for those communities that are underserved, such as children of color, children of low income, or children that speak a second language. So the task force, upon interviewing many advocates for dental care and professionals, we did not have a difficult time making recommendations. Perhaps we had a more difficult time limiting the number of recommendations possible. Thank you.
Mel?
Yeah, I probably lost a few years of my life from the stress of the campaign. And, coming out of that, it's so easy to say, oh, it's a crying shame about the vote, or to point fingers around what happened or what didn't happen. But that's not what we need right now. What we need is to set a new direction for where we can go, because ultimately, I started working on fluoridation because I care about kids' teeth. And I'm still working on dental health because I care about kids' teeth. And there's hell of a lot we can do moving forward that does not include water fluoridation. And that's where I hope we can focus our efforts, at least in the Portland, Multnomah County area.
So Mel, would you expand a little bit more on that about what can we do to improve oral health in the county? And is any of this being done now?
I think there's never been a greater opportunity than right now to do really positive stuff in dental health. We're seeing some movement. We've just had integrated dental into coordinated care organizations with health transformation. We've, for the first time, a dental director position was posted. Oregon's one of the few states without a dental director. That'll be really important in setting a vision for the state. But there's a lot that we need to do to really address many of the problems that we've seen in our community. It involves partnering more closely with culturally specific organizations, delivering services to community members that they trust, that the community members trust those organizations. Is about looking at doing better around early childhood and providing more services out in the community for early childhood dental. Strengthening our school programs and a variety of other approaches. We need to be smarter. We need to put more money in prevention, and we need to continually look at our progress and make changes along the way.
Thank you. Both Kelly, you and Mel have talked about reaching out to partners. Kelly, you mentioned communities of color. And in the report, you've identified that the mainstream health systems and dental services have proven ineffective in serving racially, culturally, and economically diverse communities. So what is it about the recommendations that you feel from the report would help address that? And I think both of you have alluded to that a little bit.
Well, specifically, our report addresses really going out into the community and providing services directly to community members that are traditionally underserved. Broad-based policies are very effective in helping many people, but not all children, and the data clearly shows that. So one of our fundamental recommendations that actually came about through interviewing representatives of organizations that work with members in the community traditionally underserved is that they desire services in their community. They desire removal of barriers to access, and they desire to do that in collaboration and partnership with our agencies so that cultural needs are met and that the trust and the historic relationships are understood. So we feel that some of these recommendations clearly address that, and we can talk about some of those details throughout the afternoon here.
Mel?
Through a historical anomaly, dentistry has been separated from the medical system in many ways, and so right now, if kids want services, they largely need to go to the dentist, and so. And yet, kids are not going to the dentist. 24% of toddlers visited the dentist in the last year. So, the question is, where do we go from here? We need to continue to honor dentists as the experts in dental health, and yet we need to start looking for more of a shared approach around reaching many kids that are not getting services. We need to provide services within community organizations. We need to look at what can doctors' offices do. We need to look at child care centers. We need to look at schools. We need to change this model so that we're preventing a lot of the dental disease in places that community members trust and where they go to naturally rather than expecting them to come to the dentist.
That also relates to something you, Kelly, shared with me, that you're real interested in the workforce issue, and I think Mel alluded to looking at various other places where you can provide services. Would you like to elaborate a little bit more on what you could see that we can be doing a little bit more with expanding the workforce?
Sure. The workforce issue is very complex, as many of you in this audience already know, in the state of Oregon and both throughout the county. And there's two primary challenges in workforce. One is simply not enough dental professionals trained in the state, and that's a statistic considered a health professional shortage area where 500 citizens have one dental provider. And in the state of Oregon, there's a 24% shortage of these regions. So there's a lot that can be done in having more professionals present in Oregon. In addition, there's a workforce shortage that isn't discussed as much, and it exists in the urban communities and primarily around medical providers and dental providers not accepting clients enrolled in Medicaid. And last year, 2014, we saw an approximate 60% increase in Medicaid enrollment, and yet national data suggests that dental professionals traditionally may treat about 20% may treat clients with Medicaid. Now, I'm an allied healthcare professional, and I do understand the high cost of education, and I do understand an overhead model to business. And yet, in other states and other regions, we see that there are dental champions. And if we have legislative policy that considers, for example, increasing Medicaid reimbursement rates for dental providers, or having enhanced Medicaid reimbursement to providers that are non-traditional, and this is something that I see that may have great ability to improve access, especially in communities in need. For example, community healthcare workers or non-traditional healthcare providers, health navigators. Many people can get trained in fluoride varnish application through Oregon Oral Health Coalition and perhaps other nonprofits in the future where we can have greater outreach.
So given that kind of a lead-in, in Oregon, we have an emphasis on the coordinated care organizations, and we've been using dental care organizations for several years to help us in our oral health. So Mel, how would you say those organizations can assist us in addressing some of the issues that have been identified here?
Absolutely. You know, and I should mention I'm on the board of directors for Health Share of Oregon, which is the largest coordinated care organization in Oregon and serves the Tri-County area. And, you know, the basic tenet around health transformation is it incentivizes health rather than tying reimbursement to specific procedures. And that's a pretty revolutionary idea. When we look at dental health, that means there's a lot more incentives than there ever has been in the past to prevent disease. And that is driving some of the new thinking, driving some of the new approaches. And we talk to dental plans, and there's never been more desire than now to invest in prevention because of health transformation and because, you know, we are at a real opportunity here. You know, and I think we'll see some great things coming out of the dental plans in terms of coming together and investing in community-based approaches. But, you know, I would also say that, you know, it needs to be a shared approach. The county needs to help out. The community clinics need to help out. The state needs to help out. We need to all work together to say, let's create a seamless system of preventing dental disease, early detection of disease, and getting people treated in a quick manner. And we aren't seeing that right now. We're seeing huge gaps on prevention. We're seeing long wait lists on the Oregon Health Plan and other places. And we're seeing not a coordinated approach in terms of treatment. And so we all need to work together to make that happen.
Very good. I'm trying to catch up with where we're going here. Also, I think, Kelly, you'd also talked about there are some other organizations that might be able to help in providing services to their members, and how are they looking at this report as far as being able to see this as a way in which they can get those services to their members?
Well, the report's just been released, but we're hoping that many community-based organizations support our recommendations. And in fact, these recommendations were guided by the input and shaped by the information we heard in our interviews. For example, some of the representatives we spoke to included NAIA and SEI, and they were very helpful in informing our committee about the challenges that members currently have in the community in receiving not only health care, but especially preventative services. And they spoke about how community members would welcome these services being brought to them. It's kind of what Mel spoke to, is perhaps considering that we need to get some of our components of dental care out of the dentist chair. And there are many community-based organizations that are well poised in Multnomah County that can begin hosting programs in collaboration with the state and the local government at the county level.
So Mel, do you have some comments about some of those challenges on how we can remove some of the obstacles that are out there?
Absolutely. You know, I think starting off, in a lot of the early childhood piece, there's an awful lot of children that are really not part of the system in a way that can easily be reached, and that's a huge challenge. You know, particularly around the Native American community, those that are eligible for Head Start, we see a hell of a lot of those kids are not signing up for Head Start, and yet Head Start is the place where we're providing a lot of dental services. Now it's a essential population, but what we're missing is the people who sign up, kids who sign up for Head Start, and then they get put on the wait list. We're missing kids that are part of low-income child care centers. And then we're missing a lot of kids that are at home with their families or with friends or so on, and are not part of the system in a real way. And so that's a huge challenge. So we need to look at how do we get the services to where they need them? How do we overcome cultural barriers? And I shouldn't say overcome, I say how do we work closely with communities to bring those services to them in a way that is easy for them to access and in a way and provided by people they trust. And so, this will take a lot of thought and energy, but we also have pretty amazing examples of community organizations that work within these different communities that have built relationships over years, and I think it will be really important to work closely with them in the future and in order to improve the health of kids.
When you talk about Head Start, that speaks my language, since I'm working in early childhood and have worked in early childhood most of my professional life. But it also says to me that we're looking at this as oral health and what can be done in the oral health arena or in the health arena. But what you're alluding to is that we need to look beyond that arena. Let's look at what's going on in our communities. And from my world, we're having early learning hubs and a collection of activities coming together to better serve our community. So from that, I would say that it looks like we should be doing what the governor has said about collective action, and how can we collectively address this issue, not just in health, but in some of the other areas. And Kelly, it seems like you have some thoughts about that. How could we bring some of our collective efforts together to address these issues?
For me, it just jogged a thought that I had. Last year, I was attending a basketball game in King County in Washington at a Boys and Girls Club. My son was playing, and there was a sign on the gym wall about their dental clinic located in the Boys and Girls Club, where families could take their children for dental varnish, fluoride varnish, and a screening. And it occurred to me, like, what a beautiful idea. That's so simple. I could read the form. It was easy to understand. And it was located right on the premises where the children and their families congregate. And I came back to Oregon, and I looked, and I looked, and I looked, and I looked for such possible avenues. And at that time, there wasn't as much development of some of the innovation that's occurring now, and it was hard to navigate the website. I went through an exercise of, like, what if I was a family member looking for these services? So I think bringing things into the community in a collaborative effort, and similar to what the governor's called for, it just requires partnerships between public and private partnerships that occur. In the state of Washington, they've done that through their ABCD program, their Access to Baby-Child Dentistry, and they've had the success of reducing untreated dental decay in their low-income preschool students by 50% in 5 years. It's now a statewide program. And we may not want to implement every aspect of that program here, but we have the capability of implementing some components here. And there are organizations beginning to do that, like Virginia Garcia is doing the Baby Wellness Days and early prenatal education, which is a component of the ABCD program, but also medical and dental integration, also maybe perhaps considering care through WIC, home health visits. There's a lot of opportunity through various stakeholders and participants to have a role here.
And Mel, what's Multnomah County doing in relationship to these things? I think Kelly alluded to some things that can be done, and I think that you know of some things that are being done and that could still be done.
Yeah, absolutely. I can't speak for Multnomah County, but it's Multnomah County, like many places, is pretty excited about doing more on dental, and there's real opportunities there, and looking at particularly the primary care piece, that how do we get doctors to include a dental component in well-child visits? And I think that's one of the big nuts we need to crack. And a lot of times, in some ways, we've aimed too high, and we've tried to do too much in primary care. Primary care is very full right now in terms of what they're being asked to do, and yet dental it's so important that dental gets integrated into primary care. And Multnomah County is looking at ways to take particularly fluoride varnish, and integrate it across so it happens in all well-child visits. If we can do that one piece, it will have a huge effect. You know, I mentioned 24% of toddlers visited the dentist in the previous year. When we get to well-child visit, it gets up to 80, 90%. If we get fluoride varnish in there, fluoride varnish prevents about, they estimated 43% of cavities. So if we integrate that into well-child visits, you're almost solving half of the problem. That is just an enormous impact. And so we need to, you know, like I said, we need to crack that nut. We need to figure out how do we make this happen in every well-child visit. And Multnomah County is definitely focusing on that issue. They're also looking at school programs, how we improve and strengthen school programs, and that'll be another key area of focus.
For both of you, what kind of partnerships then do you see possibly evolving out of this? I mean, we've talked about the dentists, we've talked about expanding the workforce, but are there other potential partnerships that you could see as helping to promote oral health for our children and families?
I personally feel there's unlimited partnerships. It depends on how we view the situation and how we look at solutions. One example that comes to mind in our report is that of Wallace Medical. They are a federally qualified health center, and they're partnering with Human Solutions, which is a nonprofit that does affordable housing. So they're bringing necessary medical and now dental care into the community of need, and also bridging affordable housing. Another aspect with that I like as a allied healthcare professional is students at OHSU can get training in the clinic, in a community center clinic, which may affect their future career decisions, or at least how they view community health in the future. So that's one example of collaboration. There can be collaboration, as we mentioned before, with the community-based organizations and really the members of the community that are most in need, bringing them to the table, asking them, you know, what do you desire to improve health and medical outcomes in your community? And that just requires a little bit of dialogue and communication.
Mel, do you have any more to add to that?
No, I don't have anything specific.
Okay. Then going back to some of our discussion earlier about this being kind of a unique thing that people that were on different sides of the aisle, so to speak, coming together to come up with some positive recommendations for the community. And so this was the first time that this kind of problem solving has come together. And it's kind of been an experiment in radical civics, as they say. So what would you say? Did it work? Could you imagine other issues that would benefit from a similar kind of process?
Well, I'm looking at many smiling faces of people who shared a different perspective from myself during the campaign. And many people after the campaign that have met me, I've heard comments, at least on 2 occasions, well, you seem so moderate. You know, so the campaign shapes a perspective that doesn't fit all of us. However, what I learned from this process, I think it's been deeply valuable. I mean, too often in our communities, in our nation, in our city, we see ourselves as different or polarized or what we need to fight for. But if we really take a step back, we all have shared common values. We all have shared common needs, both for ourselves as citizens, our community members, and our families. These aren't difficult or unique to any of us, regardless of our backgrounds or our identity. So I think this dialogue, allowing a different perspective, there's value to hearing a diverse perspective. There was value to me hearing Mel and his thoughts and understanding where his philosophy comes from. There was value in having a flexible mind and be willing to change opinions and think differently. And we could do that on many different aspects throughout our city and our state.
Mel?
Yeah, I think it was very much a success. You know, in this issue, which has been so divisive, to just get together and say, okay, let's, you know, get in a room together. And we're meeting for like almost a year, which for me was an enormous time commitment. And yet it was very valuable because it built relationships that I think are really important. It came up with some new innovative ideas, and I think it provides a road forward for how do we focus our efforts in areas where we can really improve children's dental health.
So we've come together, we've identified things that we can do. Now, when you start implementing things that you can do, oftentimes there's a price tag attached to that. So as a provider of services in the community, I often know that when you come together to say, okay, now we have to pay for these things, that's when you can have a division in the road again. So from the learnings that you've had from this, what would you suggest that we move forward when we get to those things about, okay, we want to do varnish for low-income children or in this particular community, but there are no resources. Are there some learnings from this process that we could continue to say, okay, how do we go about getting those resources to assure that that population gets served?
I would say this is so much about the political issue around prevention. Prevention, when it's done right, nothing happens. And so it doesn't get the focus it deserves because it's so important. I would also say we focus on what we spend money on, but we don't focus as much on how we save money. And there's no doubt if we really invest in prevention around dental health, we'll save a lot of money across the state. It's about saving money. At the end of the day, somebody has to pay for that prevention up front. We need to invest. We need to put in the money now so that we save money in a few years to come. That's where I say it needs to be a shared commitment. Some money needs to come from the dental plans and the coordinated care organizations. Some has to come from the county. Some has to come from the state. We all need to come together and say, it's too important not to prevent disease so that we save lots of money and we reduce a lot of pain and suffering, that this just needs to happen. And I think there's that understanding out there right now that we need to be focusing more on prevention, but they aren't the systems in place, they aren't the agreements, they aren't that true broad commitment to say we're really going to invest this money right now, and that's where we need to go.
One thing that may help that is simply even the discussion around metrics with CCOs, which many of you are likely familiar with. And that's a complex discussion and one that goes through committees and a long process. But there may be a future need to add to dental metrics because essentially the metrics drive some of the healthcare delivery in the system. So we could look at things beyond simply sealants. We could consider fluoride varnish application, wellness, dental integration, and different measures, but that would have to go through a committee process. There may be benefit for our state elected officials to have discussions with OHA and the committees to see how we might shape that dialogue in the future. And I was surprised through the study to learn that fluoride varnish, in regards to materials itself, if you look at the data, cost about 90 cents to $4, depending upon what data you read. If the best practice nationally is twice a year, it is an affordable means to have great impact and affect future outcome, upstream, with a little bit of prevention on the earlier side. And I think by having community-based organizations with further outreach, there's great potential there.
Thank you. And Mel, you know that Oregon is in the process of hiring a dental director. So what do you see as the qualities and the leadership that you would like to see in that dental director, given the fact that we've just spent a year looking at how we can move oral health forward?
Absolutely. I mean, we need somebody who understands clinical dentistry and understands public health, community-based practice. We need somebody who, cares about the community and cares about reaching those that have been underserved. We need somebody who needs to be able to make progress on creating a more culturally competent dental workforce. We need somebody who has the stature that can bring oral health issues to the governor and to the legislature and to other key actors to get the resources and get the attention that oral health really deserves.
Kelly, do you have any thoughts about that? Well, given what we've said about prevention, it seems as though having a champion of the prevention aspect would also be a marvelous characteristic in our state dental director. So do you have any thoughts about, we've got this report, we've gotten, 11 recommendations. How do we move this forward? Kelly, would you like to start?
Sure. Well, obviously, it's going to require more advocacy. I mean, both for this report and also for the Oral Health Strategic Task Force. And I think this is an opportune time with healthcare transformation and the integration of dental plans under CCOs, with public awareness around the needs for dental oral health outcome. It's a great opportunity to harvest some of that energy and to continue with advocacy. I would love to see some legislative concepts go through, perhaps through the state, that increase workforce diversity, enhance workforce, Medicaid reimbursement to non-traditional providers for fluoride varnish. There are a lot of opportunities, and again, I think there's many places we can plug in and really advocate for improved outcome in our community.
Mel, do you have some thoughts?
Yeah, absolutely. I mean, I think it requires all of us to continue to talk about oral health and say we can make real progress. We have a huge opportunity here. You know, one of the big problems in the past is nobody's paid attention to dental health. It's been something that for, you know, the majority of people, they've had good teeth, they can afford to go to the dentist, and then a minority of people have had really, you know, have had serious dental problems and can't afford to go to the dentist or have had significant other barriers with accessing dental care. And it really impacts their lives. And that's been a division around how we talk about dental care. We need to say, okay, this is an issue that we all need to care about because it impacts, you know, the state economy, it impacts childhood education, it impacts many other issues. And, you know, bad oral health doesn't just cause cavities, it's related to diabetes, it's related to heart disease, it's related to another number of other factors. So, you know, there's been this gap between the problem and the community, many people caring about the issue, and we need to change that. We need to say, this is an issue we really need to focus our attention on as a state, as a city, and say, okay, let's make the investments that are necessary to change direction on this. And, you know, and so, yeah, we need to talk with our county commissioners, we need to talk with state legislators, we need to talk about oral health and the desire to do something more on this issue.
And Mel, I know that you were actively engaged in the activities to develop the state strategic plan for oral health. And so now we have this report. We just released, I think in October, the state strategic plan for oral health. How do you see these working together so that we don't have fragmentation, but that we have a collective energy and being able to be more successful because we've got joint efforts going on?
Yeah, absolutely. And, you know, I mean, the state plan brought together people from all across the state and was focused on statewide. The City Club Dental Health Task Force has said, what do we do in Multnomah County? There's a few, you know, recommendations that need to happen at the state level, but the focus has been county level. And so I think there's that difference. You know, in terms of alignment, there's nothing that's, you know, out of alignment between the two reports. You know, you line them up next to each other. There's a bunch of stuff that overlaps, and then there's some other stuff that's in one of the reports, but not the other. So, you know, I think they'll work really well together. They're directed at different levels of jurisdiction, and you know, and I think we need to concentrate on with both of the reports of let's look at what pieces we can implement now and what pieces we can build support for in the future.
Kelly, did you have some comments?
Not really. Only one aspect to consider is with the City Club report, it may allow citizens to be engaged on a different level just because it has a slightly different outreach and a composition of members that participated, and it was involved in the Civics Labs process. So I think it adds to the Oral Health Strategic Task Force plan, and it does complement very well.
Well, I know within the strategic plan, workforce was a major issue, and that's been brought up here too, that workforce is a concern. We need to be sure that we got the workforce that's able to serve the children that we have out there that need the service. So it's connecting those two.
Yeah, and I've been thinking about that a lot because it was very important for me to include that aspect in our plan. And I think, again, from that, going to that basketball game at King County, sitting in a Boys and Girls Club, as a citizen seeing that, it made me look at access in a slightly different way. And one of the things I found quite shocking about the ABCD program, in their first 2 years of implementation, their no-show rate for their newly enrolled Medicaid patients was 10%. I'm a physical therapist. A 10% no-show rate for a Medicaid client is really amazing. So we asked them, well, how did you achieve that? That's an incredible statistic. And they really attributed that to partnerships, to case management, to calling the families, asking if they needed rides. That's where that collaboration and that slightly different, innovative approach may have a great deal of effect.
So we've gotten some ideas about partnership, and we've gotten some ideas of how we can integrate the social services with the health services. So what do you think we could ask of our elected officials to help us in framing some of the things as they go forward? Kelly, would you like to start with that?
I'm smiling because I always feel like I have a laundry list. And I don't mean that to be in any opposition. I just think there's so much potential. And I really look forward to continuing advocacy. For example, again, looking at Medicaid enhanced reimbursement rates. We need to up those rates a little bit for dental champions that are willing to accept more Medicaid clients. 20% of providers is not going to meet the outreach of what we need in our community. We would surely benefit from consideration of non-traditional providers, providers that want to work and help community members, and those providers that would be welcomed by the community. Community healthcare workers, health navigators, there's a lot of potential there, but that's going to take the collaboration of elected officials and the Oregon State Board of Dentistry. So there needs to be some dialogue around some of these considerations. Hiring a dental director, as Mel already spoke about, looking at metrics specifically and having discussions with OHA and the metric committees. Those are just a few that come to mind right away.
And Mel, given your work in this area, what are your thoughts about what we could ask of some of our elected officials?
Absolutely. I think more investment in prevention, is critical. Setting metrics, the right metrics around health transformation. Continuing to drive health transformation. Those are the key pieces, and that's where you look at the state oral health strategic plan. There's some great ideas in there. Just looking through all of that. If we get those pieces, if we have traction on what's in the state strategic plan, we'll be making a lot of progress.
So what I hear from that is that we have reports, we have a plan. We don't want these to become doorstops. These are just some more of our roadmaps and some guides that help us to align activities to get a stronger, positive oral health basis in our state.
Yeah, and I guess maybe what I should have mentioned too is let's start trying some things different. For example, in schools. Okay, we've been doing fluoride tablets for decades. Let's try doing fluoride varnish and see if we can do it better. And there's some reasons why it might work a lot better. Let's look at, that early childhood piece. How do we expand that model? How do we invest in early childhood? How do we partner with community organizations in a much more robust way? I think, we shouldn't just be doing the same stuff we've been doing for the last decades. We need to try some new stuff, and we need to study that and scale it up and see what works.
Well, and I could put a plug in for that. Since I work with early childhood, we've been able to work with our dental care organizations and have them come on site. Instead of making appointments for 80 children in individual offices, we can have 80 children seen in an afternoon, which expedites service for the children, but it also expedites service for the provider, because then they don't have to wade through those to get to the children in need. So any last comment, Kelly? And then I'm going to open this to the audience.
Only to add into that, things in the schools that may increase outreach are permission. You know, how parents and guardians allow permission for their student to participate. I'm very interested in looking at the consideration of an opt-out policy, opt-out, if we are able to bring fluoride varnish into schools. Twice a year application, maybe having permission continue K through 8. If you're in a school model like that, instead of 1 year, it may last, you know, all 8 years. Having linguistic, culturally competent education where we can provide papers that go home in a way that can include all families to have their student participate.
Thank you. So now it's your turn. We would like to open this open to questions and answers from the floor. And you have index cards on your table, and you can write your question on an index card and then hold it up for a City Club member to pick them up. We'll take questions from the audience, and as always, we invite members to the microphone to ask their question. Asking questions at the Friday Forum microphone is a benefit of City Club membership, and the membership is open to everyone. Before asking your question, please identify yourself as a City Club member and ask your question in 30 seconds or less. Also, I will read the last index card question that's given to us. So now it's your turn. Oh, yes.
Good afternoon. My name is Mary Nolan. I'm a member of the City Club. Thanks to Mel and Kelly and the other members of the committee for working on this. And I want to ask you to bring it down more to earth and be very practical. I've heard lots of suggestions, most of them things we already knew to do and haven't been doing, things like increasing reimbursement rates, expanding training for dental care professionals, expanding hours for clinics and other things. All of those, or most of them, cost money. You haven't put a price tag on it. I'd like to know the total price tag for your proposals and how you specifically propose that it be paid for. New revenue or stopping doing something else that's currently being paid for by the entities that would pay for this.
So it sounds like a Mel question to start with.
You know, I mean, ultimately, you know, it's not, I have to say, it's up to the county commission or other groups to figure out where the revenue comes from. You know, rough ballpark, county spends about $15 million a year on dental altogether. You know, if we take $1 million and we spend it on really good school programs on prevention, it will completely transform a lot of the dental health issues. So it's not so much where we find the money, it's how we spend the money that we currently have. And I think that's really critical.
And if I can add to that, the county themselves has recently recommended that they're phasing out their supplement program. Well, those are dollars that can be specifically used to target fluoride varnish, which is highly effective. The relative effectiveness is higher because it's only done twice a year. You don't lose the kids during the summer and during days off of school. That's just a very practical example where dollars already on a budget item can be transferred over.
Next.
I'm Jack Javog, City Club member. Why does fluoride varnish treatment not generate the same level of controversy as water fluoridation?
I think I'll take that one.
I think Kelly does.
Well, state it simply, it's a topical application. It's a concentrated form of fluoride which is brushed on the teeth. It's highly effective at a literature review showing 43% reduction in cavities. Because it's brushed on the teeth, it allows, for those citizens that are concerned about total fluoride exposure, it allows them a safer avenue for fluoride deployment. And it also allows personal choice, which for many individuals was an important discussion during the campaign.
Thank you.
No, I mean, in the campaign, it's like what I heard over and over is people were concerned around fluoride and fluorosis, and people didn't like the idea of having their choice taken away. Fluoride varnish, you know, there's apparently no shown impact on fluorosis, period, because you paint it on the teeth, you spit it out, you are actually not ingesting very much. And second, people have a choice. There's a hell of a lot of people that do want to take fluoride. There's some people that don't want to take fluoride in any form, and will have that choice.
Thank you. Next.
Nick Orphanakis, City Club member. I would like to make 2 points. The first, I would like to commend the committee on one of the higher level reports that I think has come through, and I was particularly impressed with your use of data. I saw 2 meta-analyses in this report. You continue to use testimonials, and that's okay, but you put them in a context where numbers were available in the background to add weight to the voice. The second point, and it's maybe really a question to Sam Adams in the group, and that's before this group disperses far and wide, that perhaps the process on this report should be audited with an idea of trying to define how you came about to writing a report of this quality, again with the idea of setting guidelines perhaps for future reports. Thank you.
Thank you.
That sounds like a compliment to me. Thank you. So who would like to respond to that?
Well, thank you for your comments. It was important for us to reach a tone that had both data and statistical merit and weight, but also be accessible to community members. I was constantly accused of wanting to write a white paper, and I think we found a middle balance. But I do think that those numbers add weight and merit to the discussion, and we appreciate your comments.
Hi, Sharon Robbins, City Club member. I have 2 parts to my question. One is, for those of us who aren't familiar with fluoride varnish, I realize that you said that the material cost is quite low, 80 cents to $4. But how long does the procedure actually take? Because that seems to be the sticking point with having your doctor provide anything. And secondly, what about, what did you look at with respect to having nurses and nurse practitioners more involved? Because for a lot of us, they've become the primary caregiver when we go to wellness annual visits.
Kelly, you want to?
Yeah, absolutely. The actual application of fluoride varnish is incredibly quick. I've heard doctors and medical assistants and nurses describe it in about 60 seconds. They do need to get training, and again, Oregon Oral Health Coalition is a nonprofit doing some of this training through funding and grants and collaborative partnerships. In regards to, there's a part 2 to your question.
Nurses, nurse
Or the nurses and practitioners. So again, there's like a mid-level provider capability. So you can have, for example, there are medical clinics where the medical assistants can do the varnish and the dental screening, and then other medical integrative care can occur later in the visit. It's a very quick process.
Mel?
Yeah, I mean, this is really the challenge on that is it's a workflow issue. We need to figure out the workflow issue. Probably it's not the doctor doing the fluoride varnish. Probably it's the medical assistant or others. But the doctor needs to be aware. They need to order it. And you need support at various different levels. You need, for a clinic, you need support from the either the director of quality or the medical director for pediatrics. You need support from the administrator, and then you need education and training to happen at the lower level. So I'm not saying, fluoride varnish and well child visits will take a lot of work. We need to figure this out, but it's so important that we do need to figure it out.
Well, again, as a provider of services, we serve over 4,000 children, and we zip them through quickly in an afternoon in each of our clinics, so it goes very quickly, and families are very supportive of that process. Next.
Hi, Courtney Brooks, City Club member. Just had a concern about one of the recommendations was child care providers doing some of these dental services. Doesn't that raise liability issues?
I don't think the point was that the child care providers are being required to do things like fluoride varnish. Certainly that's an option if a child care center wants to do that. But I think the main thing is bringing in providers into a child care center to do a screening, to do fluoride varnish, and to refer kids that need treatment to a place that they can get it. I think one of the things that a child care center can do, that should do, is brush kids' teeth. That's a simple thing. That's a recommendation of the American Academy of Pediatrics. It's a simple thing that Child Care Center can do and would have a big impact.
Again, I think this is a crossover with what other things are going on in the community. As you know, we're doing quality rating improvement systems with childcare. This can be another component of that. What are you doing in your health services for them? So that bridging between one discipline to the other and doing things collectively to get our desired result. Next.
My name is Sam Chase, a member of City Club member, Metro Counselor, and also director of a nonprofit coalition of community health clinics, and we're very aware of the need for sustained resources, and I really appreciate the report, appreciate you highlighting the need to go to the legislature, go to our council, our county commissions, go to those CCOs and advocate for support for those preventative services. I guess I hope we're all going to be involved in continuing to do that advocacy. And what are the key messages? What are the most persuasive arguments and messages that we can be making with those powers that be?
Who wants to go first? Kelly?
I just see so much potential with this. I think there's many messages that we can advocate. I mean, bringing community-based organizations into the process so we can better serve our communities is a clear message. Putting money on prevention to save dollars down the road is a very clear message that I would imagine elected officials like to hear. It's part of the triple aim of our healthcare transformation currently, so it's a perfect opportune time. And I think even the message of this is an avenue of deployment where we can bring other members in to participate, non-traditional healthcare providers, I think that has a lot of potential. And it also allows, again, just simple personal choice with improved outcome. I think that's a win-win for our entire community.
Thank you. Next.
I'm Dwayne Johnson, City Club member, and I also sit on the STEM Investment Council. I'm curious about a number of things. Number one, let's go back to financing. How do we approach this conversation and health in general from a cost-benefits analysis? In other words, we talk about how to connect with the politicians. On one hand, there's a cost for providing the service. On the other hand, we could save an awful lot down the road for all the health issues that are prevented. But we don't really have a good way of measuring that and then creating funding mechanisms to provide for that. So how would we do that?
It's a complex question.
Yes.
Obviously, I don't know the entire answer to that question, but one thing that comes out in mind is we need to start looking at our outcome measures and have data that truly shows what prevention is doing and how the outcome improves. For example, tracking things like varnish and baby wellness dental checks, but also looking at things like emergency room visits. I've read literature that suggests that many emergency room visits are due to dental needs, or at least dental pain, and that visit costs approximately $300 to $500 just to walk through the door, regardless of care that's provided. Well, obviously, if we have less people with rampant decay and untreated decay, those costs will be reduced, and that will help the CCOs. So we could start tracking that. But data collection is complex, and to have true meaning out of data is a process that we need to look at and have better collaboration and better metric assessment.
Yeah, I would just mention that this is exactly what coordinated care organizations are trying to do right now. They're saying, instead of having, pay per procedure, they're saying, okay, we have a global budget. We have this much we need to spend on healthcare. How can we spend the money so that it's, saves money down the road? And we're seeing, that's been a change in direction and a lot of thinking. One of the challenges now, though, is there's still this wall between healthcare system and community approaches. The state sometimes thinks in terms of a global state budget, but often it sure doesn't. And so, when we start to look at some of these prevention programs, like a school program, when they're doing sealants, They go into all the schools with 50% or more reduced price lunch, and they treat all the kids in the school, regardless of their income. Some of those, a lot of those are Oregon Health Plan members. A lot of them aren't. And yet, so we need to build that partnership and say, how do we create shared responsibility so that those that are responsible for Oregon Health Plan kids are helping out, and the county's helping out and saying, okay, let's jump into these community approaches that everybody's investing and everybody has, skin in the game. So that's a challenge. I think there are some good in terms of, trying to quantify what's the return on investment of different procedures. There's actually some pretty good studies out there, around different procedures. What's the return on investment? If you get fluoride varnish, it's how much do you save down the road in dental costs, and there's different number of different studies out there, and some of them are pretty compelling, and but often, just because there's a great return on investment doesn't mean we're doing anything about it.
The other aspect, as I mentioned, the early learning councils are starting to also come together, early learning hubs with their CCOs, so that we're starting to bridge those between the two, so that those collective resources can be addressed to this, so that some of those providers of service that are doing other kinds of services can also address what those health issues are, and collectively we can say what is the best plan for this community to address this. So there are more, instead of looking at the traditional, we are looking outside the box, and it looks like we need to look more outside the box. So thank you very much, and I'll turn it back over to Susan.
Broadcast time. We're out of broadcast time for the day, and we'll have to stop for now. As we close, please join me in offering our sincere thanks to today's speakers, Donalda Dodson, Mel Rader, and Kelly Barnes.